Respected audience, especially the young and the old, consultants in cardiology and medicine, and the healthcare professional personnel, I have written a book of clinical cardiology and medicine based upon my experience of teaching over the last 60 years in this country. Clinical cardiology means examination of the patient, taking his history in detail, and examination of cardiovascular system systematically, and then coming up to a conclusion what is the basic cause of all these symptoms. In history, the most important symptoms associated are history of dyspnea, that is awareness of breathing, at rest, on exertion, on sitting, change of posture, or on lying down in the bed suddenly at night, causing persistent nocturnal dyspnea. All these different types have been described in detail as the pathogenesis explained, and they have been and grouped as per the NIHA classification. Next symptom is chest pain, which is due to myocardial ischemia, that is inappropriate blood supply to the heart depending upon its demand, and the commonest cause is coronary atherosclerosis. In chest pain due to coronary atherosclerosis, the person gets pain called angina pectoris, which means sudden development of pressure type of pain, the sense of uneasiness, heaviness, and weakness, maybe sweating or not sweating. Pain radiating to arms, to the neck, and going abdomen above the umbilicus. This pain, if it is very short duration and it is less than about few minutes and responds to triglyceride, it is called angina pectoris. If it prolongs more than 15 minutes, it's called unstable angina. If it persists for over half an hour or more and sweating and apprehension, it could be due to myocardial infarction. Then besides the pain, other symptoms are edema of the feet, fever, acute palpitation, syncope, any evidence of abnormal behavior. And in the clinical examination, one examines the patient as a whole, taking his blood pressure, heart rate, many and the JVP are very important components of this examination. The JVP, which is a difficult subject, I have explained in simple language with a line diagram as given as figure number 1, which gives us about the status of the venous circulation and the jugovenous pressure and central venous pressure. Then heart to heart, the pulse rate should be counted by the youngsters, not by the mobile, but by the watch. It is very important. To find out the rate, rhythm, character, any change in the and whether it is regular, irregular. Then examination of the heart means palpation and auscultation and inspection. Most important is that on palpation you find out an area of hypertrophy, of bulge, or any restriction, or any area of abnormal movements of the heart. The second point is on the auscultation. We have on the figure number 3, we have given the auscultatory areas of the chest where the patient auscultates. The normal sounds, abnormal sounds, their respiratory variation, and other causes of the abnormal sounds, the most important being murmur. Qualities of murmur, systolic, diastolic, all have been explained clearly, and there are 3 or 4 figures which I have given as a talk, which are in the document. Now, after the history and physical examination,